Welcome to Medical Marijuana and Wellness. Today's topic is falling asleep and staying asleep with medical cannabis. Joining me is Dr. Greg Holt, someone who's had a lot of experience with sleep and a lot of experience with medical cannabis. Dr. Holt, welcome.
Thank you, sir. Good to be here.
So before we jump into this presentation, we should mention you and I did a video a little while ago on just sleep itself. That's something that the people watching this video should look at, shouldn't they?
I think so. It goes into more of the basic physiology of sleep and some things that you can pick up on normal sleep patterns.
Yeah, and I think if you're someone who has insomnia or sleep issues, it's a good video to follow, and it's on this YouTube channel, Marijuana Aware. So please take a look at it. So, Dr. Holt, let's jump into why we sleep. Why do we sleep?
Well, it's important if you break it down to the simplest thing. There's the sleep state and wake state. So in the brain, you have all of the neurons that have been active the entire time you're awake. They sort of resupply themselves with some of the molecules that they need to get ready for the next round of activity. So that's biggest thing is to replenish the neurons inside the brain.
And that goes back to your whole issue of sleep helps you survive, helps your nervous system work, and basically helps you heal and grow, right?
Exactly. There's one kind of disease state, fatal familial insomnia, where you just stay awake for several months and then you'll die. So sleep is that important to keep going. So it really does. Your sleep state helps predict how well you'll function during the day.
Yeah, and I'm sure a lot of folks watching this video, sleep is an issue. But, it's interesting to point out 1 out of 3 Americans suffer from insomnia.
At some point, it seems like everybody might. You can have an acute form of insomnia. And when some people are they're unaware that if they take a 2-hour nap during the day and they can't get to bed at the same time at, 10 o'clock at night, they call it insomnia, but it's not. It's just that you took a nap during the day. So sometimes people have got issues with pain. They're mulling over some stressor in their life over and over again, and that can keep them awake. So these are things that can really cause issues. And there's medications, there's different comorbid diseases that can cause insomnia, but a lot of different things can cause that.
Yeah, and the main reasons, as you mentioned, are really pain and anxiety. Now, what I find is very interesting is how long should you stay asleep? What is the norm?
The younger you are, the more you sleep and the more sleep that you need. So that's why this chart here is showing age groups and then how much sleep they need. So, when you're looking at 0 to 3 months, of course, it's not 17 hours all at one time, but it's usually a normal is 3 nap periods and then 1 overnight period. Thing is about the teenage years, they still need about 9 hours of sleep, and they're not getting it because they're playing on their tablet. Social events keep them from getting enough sleep, and that's an issue, a big issue. And how they came up with how much time you need to sleep is they say 8 hours a night. So you can be a short sleeper and you could be a long sleeper. But what they found out is people sleeping less than 4 hours a night or more than 12 hours a night are dying faster than the guys that are sleeping 8 hours a night.
That's interesting. That's very interesting. Now, there's something that's important to point out in your immune system, something called cytokines.
Cell active substances, yeah. Something that might be created inside the body in one site that release through the bloodstream that have an effect downstream someplace. So a lot of different cytokines that are important for our immune system function. They can signal white blood cells to come to a certain area. They can function alongside neurotransmitters inside the brain that are activating certain centers for getting to sleep or waking back up.
And as you mentioned, if you take a look at a lack of sleep, really can affect a lot of different disorders: anxiety, stroke, cancer, depression, schizophrenia, Alzheimer's. It's important to get that good night's sleep. Tell me about when you're experiencing insomnia and how to treat it.
Well, first, we'll always look at behavioral issues that might be affecting your sleep. Like we mentioned, taking a long nap during the day. So if it's a short nap that doesn't affect how you get to sleep at night, and sleep onset is usually about 15 minutes. But if you're awake longer than half an hour or an hour in bed and you're just looking at the ceiling, you need to get out of bed, go to another room and do something else in quiet type activities. Make sure you're not exercising heavy. Certainly don't drink any iced tea or something caffeinated, and then go back to bed. And when you're feeling a little sleepy, and try again, but just don't stay in bed waiting to fall asleep. That's not it. So
kind of reset is when you get a chance to do it. When you're featuring insomnia as the issue of just resetting and getting you back in that environment to fall asleep.
Exactly. That's the important part is to not stay in the bedroom trying to fall asleep if it's taken you a while, and then taking a look at the things that can cause issues with it. So you have to address all of those things that are stressing you out or causing anxiety. Address those earlier in the day. Get through all of that, even writing it down. Some people do that kind of thing, and you can try things like you can try like a white noise, like a box fan, something like that. Some people will take like a warm to hot bath, and cooling body temperature is supposed to help like give that feeling of going into a sleep state. So there's different things to try, and sleep hygiene can be researched on the internet, and go through all of those things about sleep hygiene and see if you're doing all of those things right to help with insomnia. And if it all doesn't work, then it's time to like go visit like your primary care or a sleep professional to find out if one of the some type of medication is called for.
Let's talk about cannabis for a second, because when you take a look at cannabis, it's really made up of cannabinoids, terpenes, and flavonoids. And I tend to look at cannabinoids as being something that they address the receptors in your body. In other words, they link to the receptors, they open up the receptors, and what they deposit inside those receptors are really the terpenes and the flavonoids. That's where the healing benefits of cannabis comes from. And Dr. Holt, when you look at those three of those working together, we call those the entourage effect, don't we?
Yes, yeah, exactly. And this is something that is escaping research scientists so far. They're not looking at combination therapies when they're doing their studies. They're only looking at percentages of THC, and they're stopping right there, or they're looking at a milligram strength of CBD and stopping there. So I think they're missing the point on a lot of that.
And that's the point. It's interesting how the cannabinoids, terpenes, and flavonoids all work together, and combinations of cannabinoids and terpenes work together. We'll talk a little bit about that with respect to sleep in just a moment. But cannabis is really probably one of the most medically beneficial plant that we have on the planet today that we found. Now, how does it work? Because a lot of people ask me, "Gee, tell me, how does this all work together?" We have something in our bodies called the endocannabinoid system. This was found in the 60s when we started researching medical cannabis. And what we found out is our body has what they call CB1 and CB2 receptors. CB1 receptors are primarily in the brain and the spinal system. The CB2 receptors are primarily in the blood cells, the tonsils, the spleen, the white blood cells of our body. And really, the CB1 receptors control a lot of the neurotransmitters in our body. The CB2 receptors really control inflammation in the immune system. But they all work together. And it was interesting when you take a look at why this all works, is because our body produces endocannabinoids to be able to keep itself in homeostasis. So if you hurt your finger, you hurt your stomach, you have some sort of a bowel problem, your body produces endocannabinoids, sends it to your bloodstream, to that part of your body, and it tries to keep you in balance, tries to keep you in homeostasis. Here's the problem. If you don't produce enough cannabinoids, and older folks have that particular problem. And also, if you have an injury, like I have a knee surgery or something like that, you're going to need to be able to supplement or give your body, in essence, some more endocannabinoids to be able to do its job. And what we found out is that phytocannabinoids in cannabis exactly mimic the endocannabinoids in your body. So by being able to put cannabis in your body, in essence, you're charging or giving your body the resources it needs to manage itself. This is a very fascinating process, and something that really is something brand new to a lot of doctors, isn't it, Dr. Holt?
Absolutely. When I was in 2 years of medical school at University of Florida College of Medicine, nobody talked about the endocannabinoid system at all. But we did talk about receptor physiology and various types of receptors, even studied receptors on cell membranes. But yeah, this wasn't even mentioned. So there is an emerging body of literature that's looking at this system of receptors and how they interact with the other more widely known systems.
And in defending a lot of doctors, they were never taught about this in medical school. So when you bring it up, your doctor looks at you and says, I don't want to prescribe something I don't know anything about.
I think you're exactly right, but they're relying more on their own experiences with it and anecdotal evidence. If it helped one patient, maybe it'll help the other one, like that. And they're looking at how they can do that combination therapy with terpenes, CBD, and THC to help individualize things, but it's not in the literature that way.
Right.
So it's everything is trying to catch up with what's being done right now.
Right. And I look at when I work with doctors, a lot of it is an educational process. Most of them are receptive to it. And for example, some of the things that come out here, this is a very good study about how the endocannabinoids role in the circadian rhythms and how it really does help the sleeping process. You have some comments on this, don't you?
Yeah, it does help. It does help with with sleep onset. So there's no doubt about it. I've even tried that when I was diagnosed with cancer about 5 years ago. So personal experience, it does work. But I've also seen in some of the literature where it shows that endogenous cannabinoids can affect light entrainment and phase cycling. So they're not exactly sure if it increases neuronal cell firing in that suprachiasmatic nucleus that helps control melatonin release through the pineal gland, but they know it has an effect there, so it's doing something with sleep-wake cycling.
But it's interesting, they have studies on this that show that it is working. And it's also interesting that why is this all of a sudden coming to bear? I mean, when we were growing up, we heard cannabis had a whole different image. It's because really in the 60s is when THC and CBD were really isolated and studied by Dr. Raphael Mechoulam. What's interesting about Dr. Mechoulam is he's an Israeli researcher, and he was funded by the U.S. National Institute of Health. But tell me some of the other components here, Dr. Holt. Like there's 500 chemical components in the plant, right?
Right, and we're certainly not studying all of them, and I think that's one of the bigger issues is that they're still looking at percentages of THC strength instead of looking at the different profiles that they can use. So of all the different types of phytocannabinoids that are out there, and the non-cannabinoids and terpene profiles, we've got a slide of that coming up later. It's not common to see like every one of these being tried in some concentration or some strength in the literature. And it's because you're right. The literature and the research has been stifled for decades.
Well, stifled here in the United States. Outside the United States, it's been very active. Countries like Israel, countries like Canada, UK, Germany, Spain have been, as South Africa has actually been very, very active. So it's time, I think, now for the US to really catch up because there's a tremendous amount of benefit that can come from this research. Also, we're seeing a big trend in the legalization. I know in 2024, we have 24 states that have legalized medical marijuana, both for adult use and medical, and 38 states that have legalized it for medical marijuana. Plus, there's been legislation that's being proposed now to make cannabis a Schedule III drug. So we see a lot of breakthroughs here in the taking cannabis and making it not taboo anymore, but making it more mainstream.
Yeah, they are certainly making headway. It's good.
Yeah, and this is where you mentioned in the literature, you see some interesting things coming out now.
There is. When I see fibromyalgia and I'm looking at an EEG, sometimes I don't see the kind of EEG patterns that you have with like a cancer or arthritis that where you can see pain in the brainwave activity. But it's shown here that they have subjective improvements in sleep by using a cannabinoid like navalone. Some of them have worked on non-sleep related disorders, different kinds of diseases that aren't exactly like insomnia, things like this. But what they have shown is that a heavy user of cannabis can report sleep-related problems in the majority of people that have just stopped cold. And they see some different things happening, with slow wave sleep. Slow wave sleep, we need to reset the neurons inside the brain. That seems to go down with as part of a withdrawal. You get increased dream activity, and that's good because cannabis can suppress rapid eye movement sleep. It's the molecule is similar to the tricyclic amines, and we've used that medication like protriptyline to slow down REM-dependent sleep apnea. So in a sense, it could help with sleep apnea, but it's not the way to go by suppressing REM.
Yeah.
Decreasing total sleep time is not good, and the initial things that are good is this increased slow wave sleep. So you do get more deep sleep in the first third of the night by using a medical marijuana to help you get to sleep. And that will give you like a better sense of restful sleep when you wake up. Some guys report that there's a hangover effect, and it depends on, the concentration, your metabolism, all of those things.
But it's something that really is beneficial. It also affects anxiety. in sleep.
That's one of the good things that it found. It's like in this one study here, it showed that anxiety decreased and stayed decreased throughout the entire 2 months of the study. And, while they had a decent number of people showed improved sleep at 30 days, that was slightly reduced like at 60 days. The thing is, remember, it's almost a lack of like this individualized approach to like using medical marijuana for sleep onset problems and insomnia. And that's the hard part is like medicine is taking like a certain percentage using that and saying that here we go.
And there, like I say, it's interesting. A lot of studies have shown this. I know that a lot of just folks I work with in my practice, I see clearly reducing anxiety really helps with sleep, but it also helps their life. Let's talk about the effects of CBD and sleep on like PTS, different behavioral disorders, restless leg syndrome. Take us through that.
When I made a big deal of saying that there was conflicting data, and again, it's because the idea is that they're not using like the combination profiles of terpenes, CBD, and THC to start the study, to individualize therapies. So I really think that if you can reduce anxiety by one study, then it's got to work on PTSD, to show that there's like a decrease in problems. Nightmares is a different thing because nightmares occur in REM sleep. There could be some REM sleep disorders that are going on that, that cause those nightmares. And sometimes they're caused by REM dependent sleep apnea. That you treat the apnea, the dream states get better. REM behavior disorder is like one of the more interesting sleeping disorders. When everyone dreams, they're paralyzed normally. So you don't flail around and act out your dreams. So REM behavior disorder, you regain motor control. It's like you're dreaming that you dropped your fishing pole overboard and you jump out of the boat, except you're in bed and you hit your head on the floor. That was one of my patients. So reducing dream enactment behaviors is a good idea. But here again, in another study, they were using a fixed dose of CBD. They didn't see much change in RBD symptoms, but sleep satisfaction seemed to improve.
And you're pointing out something that's really important, and that is that although you see all this conflicting data, a lot of times, a lot of the research that's been done never consulted people that really are experts or know medical cannabis. And I say that because they may be researchers, they may be doctors, but they don't know cannabis. What I mean by that is cannabis is very personalized. It's different for every person. How much you take and how much I take can be different because it has to do with our metabolism. It's very much like alcohol, and it's very much like caffeine. So if you give the same amount of product to a group of people, it'll be the right amount for some people, but it's going to be the wrong amount for the majority of them. And that's what causes a lot of these conflicting data. You don't get they don't have the dosing right.
That's right. And you know what they say in medicine? It was like, what dose do you use? You use the dose that works. So if they're doing that, it's like, why can't they do that with this kind of approach to it?
And as a doctor, as you know, when people say we're going to do a prescription, you do the lowest possible amount just to see the patient's reaction, and then have them call you if you need to increase it or something like that. In the case of cannabis, you can make that adjustment yourself. But the point is, it's very individualized. And that's when I look at all these studies and I'm looking at what are you doing to, for example, do the dosing? And I never see the dosing component of it. And I think that's a major problem.
Yeah, that's absolutely. And you know what they use for something like REM behavior disorder? It's the benzodiazepine, so Valium class of drugs. It's got physically addictive properties. And it's got a serious withdrawal side effects to it associated with it. So yeah, to try something like medical marijuana for REM behavior disorder, some of these other sleeping disorders is a big deal.
Yeah, and that's where, again, we need to do more studies, and we need to do studies with people who know medical cannabis. That's why a lot of the studies coming out of places like Israel, and especially Canada, are good because it's been legal for a long time, and they have doctors that are knowing a little bit more about the product. But the conflicts are going to be normal. But the key is there are studies to show that it works, and I think that's I'm a glass half full guy, I guess.
So you definitely have to push back on some of the negative data. It's like try to explain what could have happened that caused that that issue.
And I also want to point out there's no mention of any terpene profiles in a lot of these studies. And as we know, the terpenes are the key to making cannabis work. So we talked about terpenes, Terpenes are important because one of the three main components of cannabinoids is cannabinoids, terpenes, and flavonoids. But there's a number of different terpenes that work very well for sleep. You're aware of some of these? Like, for example, you take a look at beta-caryophyllene is really good.
Yeah, I've never used it, but I like that, a table has been made to like see some of these that come up. But everybody knows at least some of these because pine oil, everyone knows what that smells like.
Sure.
And it is a terpene, so that's like one of the common ones that just about everybody knows. But the way it's been outlined here, I like it with looking at analgesic effects,
Right.
antioxidant type of activity.
So you're going, if you're into medical cannabis or you have a medical cannabis card or you're new to medical cannabis and you go to a dispensary, ask for a product that has beta-caryophyllene in it. Ask for a product that has myrcene in it. Ask for a product that has linalool in it. And you might want to take a look at potentially even something like pinene and limonene. I say pinene with a little bit of a caution. If you have PTS, I don't recommend a product with pinene because it may bring back some short-term memory issues. Limonene is great, but what you have is the linalool helps you sleep. Pinene may make you limonene may make you a little more active. So I would lean towards the linalool side rather than the limonene side. But during the day, limonene is great because it really helps you stay relaxed and helps you fall asleep if you need looking for naps or something like that. So these terpenes are really, really important. And there's also temperature ranges. And you might ask, why is that? Because when you take a look at the different routes of administration, which we'll get to in a minute, it's important to pay attention, especially if you're vaping the product, the temperature that you're using. Now, I also should point out there's different cultivars, and the cultivar is the terpenes, flavonoids, and cannabinoids all together, and they're actually targeting, in this particular case, these particular cultivars are targeting sleep. And you can see the different you look at the terpene profiles, like we mentioned before. Here's your myrcenes, here's your beta-caryophyllene, here's your limonene, here's your humulines, here's your linalols, the different characteristics that are out there. And some of them are also noticed very indica, meaning in the couch or relaxing. Hybrid is a combination of CBD and THC, making it kind of in the middle. But notice there's none of these that are sativas, because sativas will make it, or sativa leaning, because it's actually something that gets you more energetic. So if you're looking for cultivars for sleep, these are the ones that really make sense. But Dr. Holt, there's different ways of using medical cannabis. Most people are very familiar with the famous flower, right? Just take it and smoke it. What's your thoughts on that?
Yeah, it's okay, but there are a lot of there are a lot of things with the inhalation of any kind of a substance that could gum up the alveoli inside the lungs. So I'm not like a big fan of seeing that that's the way you should. But a good thing about it is you can titrate to effect.
Yeah. See, what's
So
interesting about flower is a lot of people, when they think of cannabis, think about smoking cannabis, rolling a joint and smoking that. What's little known is, from a medical standpoint, and I'm speaking medically, not recreationally, if you take that joint, you put that 500-degree flame up to that joint, you're actually burning off half of the cannabinoids, almost all the terpenes, and almost all the flavonoids. So
yep.
what you're doing is you're significantly reducing the medical efficacy of that flower down about 50 or 60%. That's the bad news. Good news is it still works. You just need a lot more of it in order to make it work. So what I'm recommending, that if you really are someone who likes to smoke cannabis, and some people do, use a dry herb vaporizer. These are devices that you put the cannabis in, it steams it. There's no burnt material that goes in your lungs, so there's very little carcinogens. It's much easier to control because you can control the temperature of these devices, meaning you can take advantage of all the terpenes. You're not burning them off, and you'll get better medical benefits from that. But if you're having difficulty or understanding or doing that, you can buy vape pens at your local dispensary, as long as they are state licensed dispensaries, because you want to buy a vape pen that's been tested. And state licensed dispensaries are very, very safe on that. And if you want to be able to kind of make your own, you got the concentrates that are out there that can help you be able to actually take the products in different forms and be able to use it in different smoking devices. But you mentioned earlier, Dr. Holt, you don't have to smoke. I mean, inhalation is one route. You also can take drops, for example. Tell me a little bit about
Yes.
that.
Now that's a good route of administration right there, sublingual administration. People have heard like nitroglycerin tablets. The
Mm-hmm.
idea with it is it gets into the bloodstream, goes right to the heart, and it bypasses this liver breakdown bypass effect. So it's like if you try to take something like nitroglycerin orally, it gets down to the stomach, goes through the liver, gets broken down a lot before it gets to the heart and the coronary arteries where you're looking for that effect. So this route of administration right here goes right to the body first before it starts to break down. You know, it's got a pretty decent onset and not as good as like the vape pen, but you have to watch out in controlling the dose of the vape pen. So
Right.
these sublingual drops is a good middle of the road way to go.
Yeah, it's very easy to control whether you're taking a quarter of an eyedropper or a half an eyedropper. So you can find out, you can start, and we have a motto, go low, start low and go slow. Start with a quarter of an eyedropper and do that for a few days. See how you feel. If you then you can increase it, and that just see if you get a little bit more relief. Eventually, you'll get to a point where you get the relief that you want. And if you go a little bit beyond that, you'll feel it's not working as well. So you go back, and that's where you get your therapeutic dosing level. That's what helps you quite a bit. Not only do sublingual drops work very well, but sprays work also. But tell me a little bit about edibles, because this is where really the fun or the issue comes into play, because people love edibles, the brownies, the lozenges, the cookies, uh, but they take a while to work, right?
Yeah, it's not the thing for like for sleep onset, but for maintenance of sleep or problems with wake after sleep onset, it's an idea. It's an idea to like maybe try something like sublingual drops or a vape pen, and then a gummy or something like that that will help keep you asleep.
Sure. I know that in my case, I'm a chocoholic. So usually about an hour before I go to bed, I have a little couple squares of chocolate, and it helps me fall asleep and stay asleep. But it takes about an hour to an hour and a half to work, but it will work all night long. And that's the nice part about it, where a sublingual drop will last maximum 6 hours. In my case, it'll last about 4 to 5 hours. The edibles will last the whole night. I'll be able to get my 8 hours of sleep by using, I guess it's my little square of chocolate, or something like that. But one of the problems with edibles is you got to be cool. You got to really give them time to work.
Yes,
Very famous
yeah.
stories of people taking edible, it's not working, so they take another one, then they take another one, and of course, 2 hours later, they've taken 3 times more than they really want. You've never seen that happen, right, Dr. Holt?
Oh yeah, I've had patients do that with like looking at like some kind of sleep aid, benzodiazepine, where they just keep taking one after another, and then pretty soon it's like almost have to call the police to like say you can't wander around outside the clinic.
Right, right. Well, and this happens quite a bit. We have a motto that about the time you think it's not working is the time that, and you take another one is the time it starts working. So you really need to use some moderation on that. But also the same goes for capsules, because capsules take between an hour and a half to 2 hours of work, but they do last for a little bit longer time. So these are it's getting ingested inside your system through your stomach lining as opposed to the mucus in your mouth. And so this route of administration has a different effect on your body, or your body absorbs it differently. That's really out there. And speaking of absorption, topicals work pretty well, don't they?
Yes, they do. Yeah, it's the same kind of thing. You have capillaries around the skin surface that can absorb the medication
Mhm.
and then get into the site. So this is one idea for like if there's some issues and the thought is of how they can act as an analgesic, that kind of thing.
Yeah. Yeah. And if you can reduce the pain, or you can reduce some anxieties that come from that, again, that helps you sleep. So, you're treating a number of different things. I know that I have knee issues, and if I can put some cannabis balm on there and really help relieve that pain, it helps me sleep through the night. So the nice part about it is there's different ways of taking medical cannabis. You're not stuck with what we call route of administration, or one way to be able to take it, and you can personalize it, and you can mix and match them. For example, in the mornings when I get up, I first thing I do is I take some sublingual drops, and then I also grab my vape pen and take a hit off my vape pen, because my vape pen causes almost immediately for me to get relief, and then it gives me time for the sublingual drops to kick into play. And then during the day, like I might take a gummy in the middle of the day, and at the end of the day, I'll use medical cannabis as well around the dinner time. And then in the evening, I'll take my chocolate to get some sleep, because I have a situation where I have herniated discs in my back. I have 7 herniated discs in my neck, I should say. And so it's not going to go away if I don't do something about it and stay on top of it. If I wait like a day or two, it comes back and it gives me a problem. So routes of administration are important to make it very personalized. So let's talk a little about, in summary, let's talk about sleep. Sleep duration and quality are related to your health, right?
Yeah, absolutely. So it's always like the first thing to do is a self-examination of how you feel. Do you feel like you sleep okay? Do you feel like that, your daytime wake state is fine? Then you probably have no issues with sleep, and what's going on. But it's those guys that have like they looked at all the sleep hygiene issues that could come about, and do they want to try medical marijuana to help them with sleep onset insomnia? Or like problems of maintenance of sleep, and decide to go that way to see if it helps them and helps them get to sleep. But remember,
Sure.
put yourself in the right position to fall asleep naturally.
Yeah.
That means no naps, no caffeinated beverages, no heavy exercise within 4 hours of bedtime.
Mhm.
And your circadian rhythm should be on the backside of that phase to where you got adequate light, like half-hour bright sunlight in the morning in the first hour you're awake, and again, like mid-afternoon, another half-hour of bright sunlight. And you
Mhm.
don't have to be outside in the Florida sun, but just in a brightly lit room to
Mhm.
get that, to where it suppresses melatonin production inside the brain to where you can cycle up of your circadian phase and be
Sure.
ready for sleep. And
Yeah.
the medical marijuana, like the other medicines, can help push you over the edge to help you get over that edge to fall asleep.
That really helps quite a bit. By the way, I should point out to folks that we also have this understanding and optimizing sleep video on our Marijuana Aware YouTube channel. And then more importantly, on the bottom line, medical cannabis is safe. I know a lot of people worry about, is it safe? Is it not safe? No one has ever died from using cannabis recreationally or medically. You may get some negative side effects. You may get some anxiety. You may have trouble walking. You may fall asleep, but you're not going to die. And that's really critical because most pharma drugs lead to the unfortunate death option. Greg, and also people have been finding relief from medical cannabis with respect to sleep, right?
Yeah, it's there and it works, and that's one of the big reasons that they've moved to like removing it as a Schedule I drug. It does have medical benefits, and they're just finding out a lot more about those now.
Yeah, and the term they're using in rescheduling is cannabis as medicine. And by the way, I'll point out there is a YouTube video on that cannabis as medicine in the library as well. I might point out that one of the nice parts about medical cannabis is you're in control. You can titrate up and you can titrate down, and that really helps the patient, doesn't it, Dr. Holt?
Absolutely, that's part of that whole individualized therapy is to work with somebody behind a licensed facility that understands like the different profiles and can help guide you to what to try, and then see what you think about the dosing for yourself. And then if it's working, great. If not, you'd go back and try a different profile and see what you think about that. It's just like Western medicine. It's a practice. If that drug didn't work, that dosage didn't work, you go back and you try a different drug, different dose.
The other thing is you're not going to get addicted. Cannabis has no addictive properties. And unlike opium, heroin, tobacco, you cannot get physically addicted from cannabis. Now, I should point out though, in many cases, I'll take my case. If I use medical cannabis, I can take my pain level from a 7 or an 8 down to a 1, and I can keep it there. And I am not addicted to taking cannabis. What I am addicted to is getting rid of my pain. Every once in a while, every 6 to 8 weeks, I'll take a day, 1 or 2 day holiday, just to let my body reset, just to let the endocannabinoid system in my body start making sure it's active, make sure it's working. It's good to do what we call a cannabis holiday, and they recommend 4 days. I can take about a day or about a day and a half, and then my neck taps my shoulder and says, if you don't do something pretty quick, I'm going to let you know I'm here again. So my addiction is that I'm addicted to getting rid of pain.
Yeah, you got to stay
Cannabis
ahead of the
causes
pain.
no
You don't want
problems
to
for
catch
me.
up. Okay.
It's just the pain just likes to hang around. Let's put it that way. That's kind of something that you find in your business, right?
Yeah, for any kind of medication that people take, especially to control chronic pain. Who wants to be on an opiate
Yeah,
forever? That's the terrible thing about that, because it does carry a physical addiction.
yeah.
So with medical marijuana, it could be psychologically addictive at some point. But you're right. Like with anything, it's like you try to use what you need and don't try to go overboard. Some people smoke too much or drink too much, or just everything in moderation. Because if you smoke too much medical marijuana or marijuana, recreational marijuana, it could lead to like some sleep problems.
Sure.
So everything in moderation like that, you just can't keep it going and going and going. Because the first thing it does, it suppresses your dream state sleep.
Sure.
So that's an issue.
But in medical cannabis, you have a dosing regime. As long as you stick to it, it should be able to work very well. And the nice part about it is, I know when I got in this business, I thought we had to smoke it. You don't have to smoke it. And they've got some great routes of administration, like edibles and tinctures and stuff, and the topicals. The only thing about the edibles is they're starting to make such edibles that are so good, you feel like eating them like Skittles. I don't recommend that at all.
No, and you've got to like keep them out of the way of like eight people, anybody else, because they may not know what it is.
Yeah, and they like to grab them and add them. So, Dr. Holt, we covered a lot of subjects. Any final thoughts?
No, I think everything is fine. I think medical marijuana for sleep onset insomnia is a great tool in the arsenal to try to get better sleep, to feel better during the day, and let your wake state sort of tell you what's going on with with sleep to see if you can get better quality sleep.
Well, Dr. Holt, thank you very much for your time and your excellent comments. I do want to point out that if you're looking at getting a medical marijuana card, either in Florida or in places like Mississippi, Ohio, Georgia, there's a medical marijuana treatment clinics of Florida that you can get a hold of, mmtcfl.com. And more importantly, our YouTube channel, which hopefully you're watching right now, Marijuana Aware. Please share and please like. It's really important to us to be able to get those shares and likes. But we have not only information here on sleep, but also on all different medical conditions. We have different videos on getting started and what each of the different routes of administration are all about. I thank you very much for following us and watching this video, and have a great day.